All right, we will go ahead and get started. Good morning, everybody. Welcome to the July PO monthly call. Thank you for joining us. We have a little bit more of a packed agenda today than we normally do. We'll be joined by Julian Weisensell, our multimedia design expert, who will be talking through some of the updates that we are going to be doing to the admin portal as well. So I will be passing it off to him at about the 15-minute mark, and then we'll be passing it back over to Inhale like we usually do after that. So to get started here, our agenda for this morning is to look at the closeout of the 2025-2026 VBR year. We'll talk about how the performance measure is going to change ever so slightly for the next couple of years based on feedback that we've received from you all in the collaborative. We'll talk through the upcoming September 2026 collaborative-wide meeting. We'll go through the remaining events for July, as well as talking about specialist updates, the scheduling of the nephrology and endocrinology fall clinical champions meetings, for example. We'll talk about some of the updates that have been made and will be made to the dashboard, and then go through, like I mentioned, the admin portal redesign. So just as a reminder here, the 2025-2026 VBR year did end on July 1st. And so as a reminder, A1C for the 2025-2026 performance measure period is included on this year's scorecard. As a reminder, the UACR and the endocrinology 95251, even though the performance periods overlap for the most part, that's included on next year's scorecard because that performance period doesn't end until the end of August. So just keep that in mind as you're looking at this year's scorecard. If you do notice anything incorrect on your scorecards, please let us know as soon as possible. It's best to send that via email so that we have a record of that. And we'll talk about some of the scorecard updates here next. So A1C scores are being finalized at the moment. Big thing to note, we identified a discrepancy between the scorecards, the data that we use to populate the scorecard as an extract. That is the source of truth for this right now. And the dashboard, unfortunately, the dashboard's showing slightly incorrect performance for a few practices, showing it slightly higher. We did a deep dive analysis and determined that there are only 2 practices across the entire collaborative where it affected VBR percentage. So like whether or not the practice earned 0, 2%, 3%, or 5% VBR. We've already touched base with those practices. So if you've not heard anything from us about this, that means that your practice was unaffected by this and it's not something you need to worry about. You may notice a slight difference between the final performance on the push reporting that you'll get here and the dashboard, or basically what the dashboard is indicating your final score on that specific scorecard line item would be. But please keep in mind, rest assured that it's not affecting your overall VBR percentage if you have not heard from us. So that's the good news. That will be updated. The dashboard will be updated here within the next couple of weeks. MDC is currently working on a fix right now for that. We've also sent out the VBR physicians list, so that's available in the portal. That was made available last week on the 8th. We do ask that POs go in and attest to the accuracy of that list for their participating physicians and their attributed physicians. We do need that back by 7/14. That's a pretty tight deadline for us with Blue Cross Blue Shield. So we've sent out a couple of reminders. If you're not able to locate that or having any issues getting to that, please reach out and let us know as soon as possible. All right. And the last note on that is just as a reminder, VBR is granted at the practice level. So even if you had a physician that joined like halfway through the VBR year, they'll get that VBR beginning on 9/1 based on the performance of the whole practice. All right, so a little bit more in depth here, some preliminary statistics on the A1C performance measure. This is not related to the issue with the dashboard like we were just talking about, but more so just like kind of final performance across the collaborative based on the actual correct numbers. Only 5 practices across over 350 primary care practices didn't earn any of the points on the scorecard measure for this. 7 practices earned 15 out of 25, 11 got 20 out of 25, and then the rest got full points. So that's incredible. Great work, everybody. Really good to see this. As a reminder on the scorecard itself, in order to earn the 105% VBR, the maximum amount, you have to earn 85 of the 100. So like I say, full reports for the final performance measure with all the statistics and everything will be available on the dashboard this middle of this month. So we're finalizing those right now. All right, so shifting gears just slightly to updates to the performance measure for the 2026 timeframe. So the MCTTD steering committee met, which is made up of PO representatives such as yourself, many of you probably here, and discussed what the ideal timeline for future performance measures would be. And so we know that our current performance measures operate on a 14-month time frame. The idea behind that was all of the things that we're measuring are meant to be done at least on a yearly basis. But we know that sometimes it's tough to get folks in exactly 12 months later. Most folks with type 2 diabetes are seen twice a year, so it's not usually an issue. But we wanted to build in that 2-month buffer time frame, so we have that 14-month time period for the performance measures currently. That's obviously caused some confusion. It also causes additional time to kind of push outward at each year because of those 2 months. And so the vote with the collaborative was between going to a 13-month July through the end of the following July time period, or to go to a true calendar year, which would be January to December, which most closely aligned with HEDIS. The steering committee overwhelmingly voted for the calendar year. And so that's what we'll be doing for the upcoming 2026 VBR year. And so that means that the performance measures will run from 1/1/2026 through 1/1/2020, or sorry, 12/31/2026, or 2027. Excuse me, we're in 2026 now. And so that will closely align with HEDIS. Like say, there are some challenges associated with that, which we'll talk about next. But what this is going to allow us to do is really kind of go end of 1 year to the beginning of next year right immediately. And so there won't be like that gap period where there's no performance measure period happening. Some of the difficulties with that is just kind of announcing final performance and baseline performances right at the same time, but we'll talk about that as well. So like say, advantages, it's the most intuitive. It aligns closely with HEDIS. It avoids that drifting start and end date, kind of going further into the future each year. It's easier to explain, it's clearer, and it's easier to optimize with the payments for VBR. We know that there's going to be some issues with timing too, like I mentioned, with identifying final performance versus announcing baseline rates and having those both displayed on the dashboard, for example, at the same time. As well as some more structural things within the healthcare system. So changes in insurance types at the beginning of the year, we know can be a little bit more prolific as patients change their insurance providers. It's sometimes not always clear to us what attribution is going to be. It's a little bit more tumultuous in that first quarter of the year. So starting a performance measure there can be a little bit more rocky, but we'll be able to identify the effects of that a little bit better after this first time through. All right. So the other major change that we're making based on feedback is to narrow the population denominator for performance measures. And so right now, as a reminder, the dashboard has 3 inclusion criteria. The first one is that diabetes diagnosis, type 2, an A1C greater than 6.5, or the use of an anti-hyperglycemic medication, all of which have a couple of exclusions, obviously excluding any type 1 diabetes diagnoses, and then any patient on metformin monotherapy with PCOS diagnosis. The first thing to note is across the board, not just for VBR, but for the entirety of the population within the dashboard, we are removing the anti-hyperglycemic medication inclusion criteria. So that will transcend both the VBR measures and just generally the population within the dashboard. That will be going live by the end of the year to coincide with the new VBR year starting January 1st. Going further than that, a step further, for the VBR measures specifically, we're going to narrow the population to only those patients in the dashboard who have at least 2 type 2 diabetes E11 diagnosis codes in the previous 2 years. And so that excludes anybody that was identified for the dashboard via A1C criteria alone, or whose diabetes diagnoses are greater than those 2 years, that 2-year look back. And so as a reminder, the dashboard goes back 4 years right now on the first of the year, up to 5 years on the last day of the year. And then it resets back to 4 years on January 1st. And so the idea with that is it's going to be fewer patients in the denominator, but it's going to be a higher level of confidence that these patients truly have type 2 diabetes. and that they are the most appropriate for the performance measures, as well as we know that we have a number of diabetes diagnoses that folks have reached out to us to say, hey, where are these coming from? This patient doesn't have type 2 diabetes. Looks like we got this diagnosis from an optometrist, for example. We don't have any recourse when that happens. We can't remove diagnoses. And so by shortening that 4-year to 2-year look back period, it allows for those to fall out a little bit quicker. So those are a couple of major updates for the following year. All right, so shifting gears a little drastically here, collaborative-wide meeting is upcoming on September 10th. This is located at the meeting space. Please note the spelling MTG space in Lansing. The address is on your screen there. The required attendees are the PO admin lead, primary contacts, and PO clinical champions. There's a QR code to register. This is available as per always on the admin portal and has been sent out via email. Please make sure to register by Friday, August 14th. All right, and so here is our agenda as it stands now. So we'll be starting the meeting as per usual with some welcome and updates led by Lauren and Heidi, our program directors, and then going into a brief 30-minute discussion by Heidi about support for CGM implementation. So that's going to be a major theme of this meeting. So she'll be talking about how CGM implementation directly into the EMR has been progressing over the last couple of years, and what resources and tools are available to you as health systems to potentially streamline that process. We know that one of the major barriers is having to scan in PDFs or attach them as attachments in the EMR and Media Manager, for example. And then on that same thread, we're going to be doing something a little bit different than what we usually do. We'll have presenters from both Abbott and Dexcom there to talk about some of the work that they're doing in this space as well. That will allow for you to kind of see the two different models that they're using and the way that you can automate flow from Clarity and LibreView directly into your EMR systems. We'll then go into our networking lunch. And then in the afternoon, we'll have a presentation by Dr. Ostman, as well as PO representatives around supporting practices on improving UACR screening rates. So a number of you have been reached out to already by us, asking you to present. We're so appreciative of your willingness to do so. We think that this is going to be a very helpful session at the top, session topic for everybody. So we're looking forward to this one. And then finally, we'll wrap up the afternoon by looking forward to the prediabetes quality improvement work that we're beginning to kick off. We're also going to have a panel discussion from a number of our patient advisory board members talking about their experience being diagnosed with prediabetes and its progression to full diabetes. All right. One of the scorecard items for specialists for the specialist VBR scorecard is to complete a survey. And so these surveys have been sent out. The endocrinologist survey focuses specifically on dietary approaches for patients with type 2 diabetes. The nephrology survey focuses on the management of cardiovascular kidney metabolic syndrome. These were sent out via email on the 7th. They are due by August 7th, so exactly 1 month turnaround on that for full points. And then partial credit will be given if it's received between August 8th and September 1st. We will be sending out reminders on a normal cadence for this as well, but please make sure to touch base with your specialty practices. Speaking of specialists, we're currently in the process of nailing down all of the dates for the Specialist Clinical Champions meetings. Endocrinology is scheduled and calendar holds have been sent out. That one is November 3rd from 5:30 to 7:30 p.m. The Nephrology Clinical Champions meeting is still in the process of getting narrowed down. So we have 4 possible dates. A poll was sent out. So you can see those dates here on your screen. The calendar hold will be sent out to all nephrology practices as soon as we nail that down and have that scheduled. And then just as a quick FYI, these are a couple of our major upcoming events for July. We have our patient advisory board meeting this Thursday. We have our advocacy group, which I'm sure some of you here are on the 17th. And then our next learning community event is also on Friday, the 17th. And that one is around insulin use in type 2 diabetes again, led by Dr. Karen County Stout. And there is the slide for that. All right, a couple of dashboard updates. So we did push our Q2 dashboard enhancement out on our Q1, on 4:30. A couple of major that had data through 4:30, excuse me. A couple of major updates here is that the urine albumin to creatinine ratio on the patient profile now does include when there is a text-based result. So oftentimes, most of the time, we get numeric results, as we should, but occasionally we get a coded value that indicates a common text-based phrase. So, for example, positive, negative, normal, abnormal, undetectable, those types of terminology. Previously, when that was received instead of a numeric result, we would just display the service date because we didn't have a way to translate that onto the dashboard. Now we do. And so if a patient has a UACR that comes through as normal, we will display the term normal on the patient profile so that you can still see that result. Obviously, when we receive both a numeric and text-based result, we'll always default to the numeric result so that we're displaying the most useful of the two. But do note that. So if you see them on the dashboard now, that is expected. The other major thing is we've been talking about this for a couple of months now, but the operand issue is resolved. So as a quick reminder, practices, we're seeing patients come through that we're showing as having a less than, for example, less than 6.5 A1C or less than 7 A1C, I think would actually be the correct one based off of the claims ranges. And that was because historically we had only gotten non-equal sign operands in claims. And so we had built that logic in. But then we started having them flow through in clinical data, which was unexpected. And that logic didn't exist yet there. And so it was ignoring the operands. And if the patient had a less than 7 A1C reported, it was seeing the 7, thinking it was a discrete value and qualifying the patient. That logic has been updated and fixed, so those patients will no longer show up in the dashboard because of that less than sign operand. All right, with that, I am going to turn it over to Julian to go through the redesign process and a number of polls that we're going to have for you about what your preferences will be on the admin portal redesign.
Thank you, Jake. Good morning, everyone. I'm Julian Weisensell, multimedia design specialist. And I will present to you just some little information about the process in which we're going through for the redesign, and then ask some questions so that we can get a gauge on how you feel about the current design. And of course, we'll ask similar questions later on once we've launched the redesign. So most of you should be very familiar with the portal, but I'm just going to go through quickly what the portal is. It is the central online hub for participation in MCT2D. It is used to track and manage participation. It's used by PO level users, practice liaison and clinical champions, and some physicians/providers. Most users come to the portal to register for meetings, complete required activities such as feedback surveys, access event recordings, things like that, and check participation status, view performance measure progress in different push reports. So as part of this redesign, our goals are to increase the clarity and understanding of participation requirements. Sometimes there's some confusion as to what counts as participation for what events or what activities. So we are very interested in increasing that clarity, so there's less questions and the ability to actually take more action. We want to also increase the confidence in our tracking system, so that everyone, as they're using the portal, can feel have clear communication as to where scores are and how their PO or practice or position are doing in achieving their VBR. And to also provide agency so users can easily verify their most common concerns and questions. So where are we at in the process? Some of you have participated in some of our feedback sessions, one-on-one feedback sessions or focus groups that we've put on throughout the year. So we spent quite a bit of time learning about how people use the portal and in what ways can we make it easier to use and reduce any friction or pitfalls or roadblocks in its usage. So because of the complexity of the admin portal in the data handling and functionality, we are going to be doing a phased launch. In September, at the beginning of the VBR year, you can expect to see a redesigned landing page that will allow you to see an overview of how your PO practice and physicians are performing, track and take action on tasks specific to your role, and view and share upcoming deadlines with your practices. We're also giving you the ability to increase the personalization of your landing page, so you'll have the ability to move around and make visible certain areas of the portal that you access most through the landing page, rather than having to click and dig deeper for it. And there'll be much more things to come as we continue to build out the portal redesign. As we launch new portions of the portal, we'll continue to collect your feedback. So look forward to invites to one-on-one feedback sessions and focus groups. And now we'd want to take the opportunity to get your general feelings around the current admin portal design and some preferences on some of the portal design. So here are some poll questions. The first question being, how would you rate the admin portal in each of the following areas? One being poor, and five being excellent. And so we'll give you a little bit of time to answer that question before we move on.
And Julian, I believe they should be able to see all 5 questions at the same time right now.
Yeah, so you should be able to see that that we're asking for like how would you rate it on user friendliness and ease of use, the navigation, the current visual appeal, clear and actionable information, and reliability. Let's see. And then Jake, were you saying that they could see all 5 of the first question is what you're saying?
All 5 of the first question, yes.
Yeah. Okay, cool. And then I think once we have most of the responses, Jake will display the results, and then we'll move on to question 2.
Yep, a couple more seconds. I know there's a lot here. All right, I'm seeing it taper off, so I'm going to go ahead and end the poll. All right, there you go, Julian.
Okay, thank you. Yeah, it looks like we have a good spread of responses, a lot of 5s, a lot of 4s, but a decent amount of 3s as well. So that's excellent. All right, next slide, please. So how does the portal compare to other tools that you use for your QI work? Is it better, worse, or the same?
Couple more seconds.
Oh, it's a good split too. 56% better, 44% the same. Great. Next question, please. So how valuable would a search feature be in the admin portal? We've had some requests for the ability to search, but we're kind of curious as to what many of our PO level leads, how they would find, if they'd find that valuable, or at what level rather.
Couple more seconds.
Okay. It's got a pretty good spread on that as well. 19 for extremely, 31 for very, 38 for somewhat, and 13 for not valuable. All right, next question. So, what would help you find pages or tasks more efficiently? This also mentions search, but it has options such as fewer pages in the menu, better page titles or descriptions, of course, search for a page, um, show recently visited pages, show favorites or pinned pages, and then clearer grouping of related items. And for this, if you could select your top three, um, I know that all of these could make finding pages easier or completing tasks more efficient. But what would you find? What are the top three ones that you think would improve that for you?
Couple more seconds.
Okay, good spread as well. All right, next question, please. Or next slide, rather. Okay, so in this portion, I'm going to show you actually some examples of different navigation styles. And I'm going to ask you which of these you prefer. A being the minimal navigation with fewer top-level menu options. B is a more detailed navigation with visible subsections or visible sections and subsections. And then C is a hybrid approach with a simple navigation, but it includes a search function. And then D would be no preference at all. So um, yeah, this is the first option. This would be sort of a top level menu, just all of the current content that exists on the portal would be distilled into a few menu options, and these are examples of what that might look like. And then the next one, B, this is if we were to kind of keep the same level of detail or the amount of options that are in the navigation, but with a better organization and visual hierarchy, with the ability to search within the navigation bar for the page or task that you're trying to complete. So the search wouldn't necessarily search for particular content throughout the portal, but it would search for a page or a task that you're trying to complete. Next slide. And then C is sort of a hybrid where you get the simple menu, simple navigation distilled into those few options, but then there's a search function, and that search function would be more like a typical search function that you'd see from a website where you would search and it would give you the results would be based on like the content of the page and page title and task. So much more similar to like the search if you were to use the search on MC2DD, sorry, if you were to use the search on our website where it will pull up any page that has the keyword that you entered. And I think that's all for me. Thank you.
Launching that last question though, right now, Julian.
Oh, I see.
I just had the slides up, so
I see. I
people
didn't
should be able to
realize.
vote now.
Yeah.
Yeah, you're good.
And while you answer this, I just want to take the time to thank you. I know many of you have participated in some one-on-one sessions and in the feedback group or feedback sessions. And so, sorry, group feedback sessions. And I really do appreciate that. It's been very enlightening and very crucial to our work in improving the tools and resources that our members interact with.
Go ahead and end the poll and share those results.
Great. Thank you.
All right. So last thing here. Our next month PO monthly call dates here are on your screen. So it'll be Monday, August 10th at 11 a.m. and Wednesday, August 12th at 2 p.m. With that, we'll be passing it off to the Inhale team. Carrie, is that you today?
That's me, yeah.
All right, I'm going to make you the host.